am Tiffany Crowell Frazier, a registered nurse with South Health District 81, Public Health in Valdosta, Georgia. I've had the opportunity of serving as the program manager of our Perinatal Health Partnership home visiting program, where we impact the lives daily of moms that are pregnant, postpartum, or have infants up to age of 1, where we serve them in education, resources, and home visiting to have healthy pregnancies and healthy birth outcomes. We do this with a goal to impact and to decrease maternal mortality and infant mortality in Lowndes County, our district, and overall in Georgia. One thing in life that our women, we look forward to is having a healthy pregnancy, a healthy baby. That should be a happy time. That should be a wonderful time for mom, family, and all involved. But sometimes things don't go as planned. There is something that is called maternal mortality. And that's why we're here to talk about the maternal mortality rates, the effects, the resources, and how you can take a part in the call to action. And maternal mortality, that is the death of a woman during pregnancy, during delivery, or up to 42 days after they give birth. Some resources also say that could be in a year's time frame of death for the mom. This is unfortunate. Especially during what is supposed to be a happy time. But this is something that happens not only in our county, but throughout the world. And the maternal mortality rate is an indicator of the systemic challenges that our communities have, an indicator of the health of our community, as well as social challenges, and it also is a marker of the social determinants of health that impact the health outcomes of moms. As well as a maternal mortality rate, it can vary from year to year depending on how many births or deaths that occur. And also maternal mortality rate is a number that is seen throughout areas that can be different, that can vary. But what causes it? There are certain causes and each case is different. But maternal mortality can be caused by pre-existing health conditions such as heart disease, stroke, diabetes, that can be unmanaged during a woman's lifetime. With those health disease processes, those can be managed, but those are some indicators that can cause a case of the maternal mortality, as well as things that occur during and after pregnancy, such as infection, hemorrhage, which is bleeding, during the delivery process or after, or also unsafe abortions as well can contribute to maternal mortality. These are things that are looked at and the data is collected, extrapolated to see why these things are occurring. One thing that I love and enjoy about my role in public health is to be able to educate, empower, and to provide the resources on why things happen and how we can combat those issues. So when we talk about heart disease, strokes, hypertension, I urge my women and educate families to ensure that our women go to the doctors even before we find out that we're pregnant. Go to the doctor annually and more if needed to make sure you manage your hypertension if you have it. First off, find out if you have it and how to manage it. If you are diagnosed with any heart conditions or hypertension, exercise is important. Consistently though, we can't just exercise 1 or 2 days and think that's okay. We have to do it consistently, as well as if we are prescribed any type of medication, take your medication as prescribed. And also advocate for yourself and ask questions. If you don't understand, please ask your doctor. Have a relationship, a working relationship with your medical provider so that you can be aware, so that you can ask questions about your body. You only get one life, one body. So these are things that we can think about that contribute to maternal mortality, but things that we can also keep in our minds, keep in the forefront of our minds, and how we can impact this issue. Another contributing factor to maternal mortality that has been seen is preeclampsia, eclampsia. Preeclampsia is when high blood pressure is present along with protein in the urine. So one of the things that we do in home visiting in public health is go into the homes and we check mom's urine just like they do at the doctor's office to ensure there was no protein in the urine and to ensure that if hypertension is present, that we do everything that we can to monitor that and ensure that mom is healthy along the way. Eclampsia is when seizure disorders develop along with preeclampsia. And so if those things are controlled, mom goes to the doctor, ensures that she's getting the proper care that she needs. That can decrease a case of the maternal mortality, as well as strokes, heart disease. That's something that we want to have controlled before during the pregnancy. But how can we do that? By being advocates and going to the doctor. And one thing that we have found throughout our research after the many years is that 87% of the maternal mortality cases were preventable. And that is one thing that we want to talk about, is how can we prevent these deaths from occurring? One thing in public health throughout the state of Georgia is what we have is a maternal mortality review committee. That is a committee comprised of a multidisciplinary team of physicians, epidemiologists, nurses, midwives, public health staff. And what this team does is they review clinical, non-clinical information to see what was the cause of that death that happened and to see could there been anything that happened to prevent that death. Also, data is collected to see how that can be used to prevent those deaths from happening in the future, and also to present that data to stakeholders, policymakers, so that programs, funding can go towards the programs that can be put into action, implemented in our local communities to prevent the maternal deaths. Also, there is a program called Peace for Moms, PEACE. So that is a program where public health partners with Emory University to have psychologists on staff to provide those resources, phone calls to moms that may be going through mental health, such as anxiety, depression, postpartum depression, because that is also a contributing factor to a maternal mortality case. But Peace for Moms provide those resources, online resources, telephone resources to be able to talk to moms, provide those therapeutic services that are necessary to get them through those trying times. And I want to highlight home visiting works. Right here in Lowndes County, Valdosta, Georgia, we have Perinatal Health Partnerships, formerly known as the Baby Love Healthy Start Program, where we have enhanced our service by providing clinical services in the home. Now, we don't take place of the doctors, OBGYNs, but we add an extra layer of care by having nurses, social workers, community health workers going into the homes, doing vital signs, fetal heart tones by RNs, also collecting our urinalysis to make sure that the urine is normal, fetal heart tones to make sure there's movement, make sure baby is moving, and also provide education on safe sleep, folic acid intake, breastfeeding, and also going to those doctor's appointments to make sure they get the appropriate care. This is done to make sure that our moms are taken care of and that we have healthy birth outcomes and ultimately decrease maternal and infant mortality. Why home visiting? Because we can go into the homes and possibly recognize things that may not have been caught. Why, you may ask, is home visiting important in maternal mortality? Because we go into the homes and we provide clinical services as well as education and resources to equip that mom with education, information on how to advocate for herself and how to have a healthy birth outcome. Home visiting programs has become prominent in counties throughout the state of Georgia. So home visiting is an indicator and also an asset to decreasing maternal and infant mortality. So this year, April 11th through April the 17th is known as Black Maternal Health Week. And African American women are known more likely to die from and death of their infant, pregnancy, or a year after they deliver. And why are we here? To talk about how we can make a difference, how you can make a difference. We want you to advocate. Be aware of what causes the maternal mortality. One thing that we focus on in home visiting programs is access to care. Lack of access to care is an indicator that can contribute to infant or maternal mortality. And so one thing we do in our home visiting program is provide gas cards to help our moms, families get to their doctor's appointments. We also provide education that they may also hear at the doctor's appointments. And we also link our moms, families to transportation services that may help them get to the doctor's appointments, because access to care, transportation can be a barrier in cities, counties that may not have a public transportation system. So these are things that are present in your communities. So be aware of the resources, education that are available in your community. Another thing that you can do is collaborate. Collaborate with organizations such as public health. Advocate and collaborate with doctors' offices, hospitals, healthcare professionals. Come together as focus groups, stakeholders, to talk about the maternal mortality rates in your community, what affects them, social determinants of health, what's going on around them, childcare, education, access to jobs, what can empower these moms, equip these moms and families. So the more you know, the more that you're aware, you can advocate for healthy pregnancies. And another thing we can do is outreach. Once you identify this information, learn this information, once you're educated, do outreach in your area. Provide resources such as handouts, pamphlets on home visiting programs, other public health programs that can help equip, educate, empower moms and families on how to have healthy birth outcomes, not only healthy birth outcomes, but how to be healthy, and the importance of partnering with doctors to know their status, know their own health, know your own bodies. So that's one thing that I want to call you to action is become aware, educate yourself, and partner with your public health organizations on how you can help decrease maternal mortality in your area. It's only going to get better when we work together to empower, educate, equip, and uplift our communities in these areas. So as we look forward to celebrating Black Maternal Health Week, I urge you, I empower you, I implore you to learn about this in your area, join forces with us, educate yourself on home visiting programs, and reach one, teach one. As you see a mom that is pregnant or expecting, encourage her to exercise, take care of her body, go to those appointments, help her get to those appointments, and most importantly, be connected with your local policymakers, stakeholders, so that you can educate them on the importance of things such as home visiting programs, so that policies, laws can be made to protect moms, families, healthy babies. Because in public health, we prevent, we promote, and we protect. So again, help me celebrate Maternal Health Week, Black Maternal Health Week, as we continue to uplift our communities and having healthy moms, babies, and families. Thank you.